Hi, and welcome back, everybody. In today's episode, we are going to talk about if you have a breast lump or find a breast lump, what do you do? Now, what? Do you wait to see if it goes away? What are you going to do? So, first thing I would recommend if you have a lump, definitely notify your primary care doctor. Notify either your OBGYN or your family practice doctor, and just be sure that you mention that there is a new lump that you have felt and you need to get imaging to check that lump out. Now, the first line of imaging can vary from different patient age, different location, but most of the time you're going to start with a breast ultrasound. Now, breast ultrasounds don't have any radiation. They're very quick and easy to schedule typically, and you shouldn't have a super big delay in getting that imaging. And that would be the first thing to do. So you want to notify your doctor that you are having this lump, and you also, want to find out if they can order imaging for you. That will be your first step in getting this worked up adequately. Worked up means, finding out what it is. Now, lumps are very common before menopause, during breastfeeding, all of those things, we can develop lumps that are not cancer. So I don't want you to immediately panic and think, oh my gosh, I definitely have breast cancer, but they always need to be investigated. And how we investigate them is the doctor can feel it, but we also need to look at it on the inside to see if it's a real finding or not. Like I said, you can also get lumps just from your cycles, especially during breastfeeding. Lumps are very common. But if there's something you're noticing that is persisting, you'd need to talk to your doctor about it and see if you qualify for imaging. So that would be the first thing, is to get some kind of imaging. And ultrasound is typically the quickest first step. Likely they're also going to recommend a mammogram at the same time, depending on your age. If you're 20 years old, mammograms aren't as helpful because mammograms are really better at looking at older breasts, but not in every situation. It's very different based on, the type of tissue that you have in your breast. And basically, like the thicker, more youthful, aka dense breasts, the harder it is to see through on mammograms. So that's why, ultrasounds are typically a classic first go to move to see if there is actually a lump in that area. If there is a lot, or if they don't see anything on ultrasound, they likely will move on to mammogram. And mammogram, is a test where they perform, very low radiation x-rays and look at your breast from up and down and side to side. And they should be ordering what's called a diagnostic mammogram. So a screening mammogram is just a kind of broad look. I think of it as like, taking a picture, but not necessarily zooming in on anything. A diagnostic mammogram is like when you take a photograph, but you zoom in on a specific area. And when you do so screening is necessary, when there's not a finding. But when there's a complaint, when there's a lump, when there's pain, when there is nipple discharge, something like that, you need to be getting a diagnostic mammogram, not a screening mammogram. And sometimes there can be, some confusion from the primary care physicians on that. So just for your knowledge, the correct test to order in that situation is a diagnostic mammogram. Okay. So that's the first sequence of events. Now, if they see something on mammogram or ultrasound, they might recommend a biopsy. Now, why is a biopsy important? Everyone says, oh my gosh, there's something, I want it taken out no matter what. So why doesn't the surgeon just take it out? Well, I'll tell you why. Because there can be different findings on that biopsy and the surgery is different. So I perform a different surgery for a cancer patient versus if I have someone who has something that's may be benign, but making them worry or cause them pain. What the difference is in a cancer surgery, I'm not only resecting the mass, but I'm also paying very close attention to the margins. In a benign lesion or a non cancerous lesion, those margins are not as important. So I could be taking a very different amount of tissue based on if something has cancer in it or if it doesn't. The second thing that I do differently when I do a cancer surgery is I check the lymph nodes a lot of the time. Not all the time, but most of the time, I'm checking lymph nodes, and that's a separate incision. That's not something that I would want to do in a separate surgery if I didn't have to. So, that also gives me a lot of good information when I'm doing the surgery. So again, the biopsy, and I always say this, like, you want your surgeon to measure twice, cut once, right? We have the possibility of doing a biopsy. Wouldn't it be better that we have a full picture of what's going on here instead of, going in blind and having to do multiple surgeries in the past? That's at least my practice. I think, I'm always trying to get patients to one ultimate surgery and not multiple. And I think many other surgeons in practicing medicine feel the same way. So that's why biopsy is important. Now, another question I also hear a lot in the community is, but will the biopsy spread breast cancer? And the answer is no. Breast cancer in particular has no evidence of what's called seeding. And that is where, when you poke the breast cancer, you pull cancer along the tract. Now, that is true in other types of cancers, but not in breast cancer. So, biopsies are perfectly safe. They are needed, like I said, from my standpoint as the surgeon, to help plan your surgery and give you the least amount of surgeries in the future with the best or with the most information at the time. So I hope that all makes sense. I hear this question almost every day in my practice. So I hope this helps someone. Please, let me know on if this is helpful or not, if you're liking this information, what questions you have, and I will do my best to answer them. All right. Thank you so much. Have a wonderful day.